I, as a breast cancer survivor, will tell you how to cope with lymphedema from a survivor's point of view. Next slide, please. Knowledge is power. So the moment I was diagnosed with breast cancer, I attended a lymphedema workshop. I went all the way, my chemotherapy was going on and I had lost all my hair, but still it was a high priority thing for me that I needed to attend a workshop to know how things are. I being in the health sector, I knew that as the surgery for my case was stage 4, so I will lose lots of my lymph nodes and lymphedema is going to be a very important issue for me. Over and above that, I being a dental surgeon wanted to get back to work after treatment for as long as I can, and for that reason, health of my right hand was equally important. And up there, I met a lot of, in that workshop, I met a lot of people of the support group who were way ahead in me in their journey through cancer. And I realized that they know so many small little nuances which the doctors and physiotherapists may not let us know. Next slide, please. So the goal of any treatment for lymphedema is immediate treatment is to release swelling, but the ultimate goal of any lymphedema therapy should be to make the patient self-manage and control the chronic condition. Because if there is a massive surgery, like it was in my case, lymphedema is a lifelong threat, and you have to constantly manage it. Next slide, please. Consequences. So what happens post-surgery, even if it is a initial stages of lymph package, there is functional deficits, there is loss of mobility, there is difficulty in wearing normal clothing, and there are psychological issues. These things may be little or they may be more, depending on how massive your surgery is, but they are there. The little bit of difference in all these things does happen post-surgery. Next slide, please. Patient education. So while patient undergoes surgery, there is very important, like my esteemed speaker before me have put stress on, that it is very important that patient education should be at the top of the bracket, and the patient should be made aware of diagnosing the self-diagnosis of things which are not to be ignored, and also taught about home exercises, self-massage, skin care, precautions, and compression bandage. In the initial stage itself, if you start wearing, then the lymphedema may not become too huge. So all this education needs to be imparted to the patient to empower the patient by the surgeon. And if they are not having that much time to do that kind of counseling, by a counselor or by the physiotherapist, anybody, but it should be done. Next slide. Sequellae. So if you have these lymphedema, which is long-standing, you will have chronic swelling, excessive tissue proteins will be there, fibrotic changes will happen, chronic inflammation, infection, cellulitis is a very high precedence of that, and PUD orange. You know, I felt that I, being in the health sector, I knew what is PUD orange. I knew that there was changes happening in my hand and things like that, but not many people know. So the rest of the things, probably these are more of a diagnostic signs, not symptoms. But PUD skin changes can be something which you can teach to the patient, that please be aware, and if it happens, do report back. Next slide, please. Signs of lymphedema. There is puffiness, heaviness, fullness in the limb, stiffness, and weakness and fatigue, skin tension, numbness, paresthesis. These are the colloquial and general language words which you can tell the patient को कि भाई तुम्हें heaviness लगेगी हाथ में तो तुम इसको lightly मत लेना, अगर तुम्हारे हाथ में fatigue लग रहा है तो तुम इसे lightly नहीं लेना. You know, because I have seen कि earlier क्या होता था कि if I overwork किसी दिन तो थोड़ा fatigue होता था, I would have a rest and next day I would be normal. But now I know that I cannot push my boundaries where my right hand is concerned. The moment I feel कि it is having fatigue, I leave that thing totally and start exercising to move my fluids. Next slide. So what happens in lymphedema is that you have to have a multi-pronged approach. Do all the good you can, by all the means you can, in all the ways you can, in all the places you can, at all the times you can. And these kind of workshops and our support groups, it is to spread the knowledge, to all the people you can for as long you ever as you can. This is this is something John Wesley has said. I loved it, and I'm sharing it here with you. Next slide, please. Thank you. I am Dr. Seema Goyal. My email is here in case anybody wants to get in touch with me for any support group activity or awareness workshop. I would love to work pro bono for such aspects. And I am thankful for the opportunity given here to empower the public. Thank you.